Today, let's talk about this diabetes in TCM perspective. I actually picked the topic as balanced sugar, balanced life, because the new idea about treating diabetes is not controlling your sugar. It's not just control your sugar in a normal range, because it doesn't really guarantee you're going to be safe from now on. Okay, because more and more we're seeing clinically, there are patients who are having their sugar controlled by either insulin or oral medication. And their sugar level, after tested, is actually within normal range. However, they might still go to the doctor and say, well, I still feel pretty severe thirsty sensations, or I'm losing my weight, or I'm having other conditions. Even all those were all normal. And it also doesn't guarantee 100% you won't have any complication in the future. It just means you are safer comparatively. That's why I think TCM still have, or other medications or other medical systems still have some job to do. So today, I would like to talk about balanced life, because that's the only way to make sure you're in a safe range. So complications, that usually is, we always say TCM is good for this. And because quite a lot of them in conventional medicines, we just don't have too much good solution yet. Okay, let's look at that. Most people, they don't even know they have diabetes until they have complications developed. And they go to the doctors because of those complication symptoms. And they trace back, they find, oh, you probably were diabetic since 10 years ago. And they were shocked. So what are those symptoms? What are the reasons they go to see a doctor? They have heart disease. Well, they have high blood pressures, blindness. They have eye issues. Because remember we say blur visions? But when you have already blurred vision issues, it's already kind of pretty late. Kidney disease. They might end up dialysis. Have to be on that for life. Nervous system damage. Amputations. Their legs or their fingers has to be chopped. Okay. And that's actually one of the major issues now. And I think probably Steve mentioned in Hong Kong, PC alone, they have some study done. And they found some TCM formulas has really good effect to prevent or reduce the rate of amputation. And that's quite exciting. Okay. Dental, because you know what? If someone who has to get amputation, it is just not that surgery costs you. All the following care is a big damage for the medical care system and the family as well. Okay. Pregnancy complications, sexual dysfunctions. Okay. And I also take attendance from WHO. Yeah. And actually, they didn't put diabetes into the list that you can really treat. They put into a thing that it might be possible to help, but we don't know how it works, so we need more evidence. Okay. Treatment protocols. Okay. This is actually, I just want a new strategy now. You can see the first one put in the center is education. It's totally globally agreed now. The most important thing for treating diabetes is the education for the patient. Only when they're aware and understand what's happening, they will cooperate with you. If they don't understand, no matter how hard you try to treat this person, it won't go into the right direction. And other than education, the diet, exercise were already quite famous as the two major things. Usually these two are the first line. When the patient is diagnosed as a diabetes type 2 nowadays, the first thing to do is to try exercise and diet therapy for about 2 months. If it works, then they don't need any medication. If it doesn't work, then the doctor will consider, the family doctors will give them oral medication for treatment. Okay. Prevention. This it might be interesting to know. There are a few ingredients or herbs I want to introduce you today, which is very easy for you to learn quickly. Some of the things, after study, they found they have really good benefits to diabetes people, or been helpful to their treatments. First one is bitter melon. And for treating sugar issues, we all know there is internal heat generated. More or less, everyone has some internal heat when they have sugar issues. Sugar is part of the energy. It burns that to get energy. So sugar, when it's high, the heat is high. Okay, so bitter herbs are one of the very important key to be used. Bitter herbs. So bitter melon is one of the things. It's been actually being studied, so there's evidence-based. So it's working for both type 1 and type 2. Neither one, it actually works. And they found it's also good for people even have insulin resistance already. Beautiful for that. Okay, cinnamon is one of the herbs actually they use, and they found it's also working for diabetes people to control the sugar level. Interestingly, I would like to introduce this last part. Although it says, blood sugar will drop between 18 to 29%, all three groups receive cinnamon. However, only the participants who had taken the smallest amount of cinnamon, smallest amount, 1 gram, continue to improve blood sugar level 20 days even after it stopped. Do you know why it catches my eyes? In TCM, what's the moment we use very small dose of cinnamon? When? When we want to bring the fire back to the yin and yang, right? And that interestingly shows similar things, very interestingly. And they say the researchers didn't understand because they didn't study TCM. Okay, rhodiola. That's another my favorite actually in the last 2 years. I still have great interest in studying this herb. In Chinese, we call it Hongjingtian. And in English, it's called rhodiola. It's originally found in Tibet. And it's a herb actually grows in a higher altitude, more than around 3,000 to 4,000. And rhodiola is also helpful for diabetes. They have a test to put, they actually studied rhodiola and cinnamon together. And they found the arm of using rhodiola and the arm of cinnamon, they both have the sugar decreased, actually. Okay. North American ginseng, or I should say Canadian ginseng. What's the nature of the herb in TCM of American ginseng? And which channels it goes to? Lung and stomach. So it's really good yin tonic and qi tonic. It actually tonifies the qi and yin together. So it's really good for Shauke. It's really good for diabetes people. Yeah. Okay. So this is also being, it was actually researched in Canada, St. Michael's Hospital in Toronto, U of T, and they found this actually have good function. Okay, so it's quite exciting as well. Cordyceps, that's another herb. It's also being found to have that function. And see, in TCM, it's actually so good for lung and kidney. Okay, when we talk about Shan, the upper, middle, lower, it's lung, spleen, and kidney are affected in this disease. And it's still the same. It's the same. Okay. Case 1, received about a month and a half ago. She's also from Victoria, recommended from different resources. But she is having hyperlipidemia, means high cholesterol. She's overweighted, much overweighted. She's having some heart issues. So she's on so many drugs. You can name it 10 drugs at once. And the sugar is still high. She's on insulin as well. Again, I gave her herbal medications and I told her to do acupuncture. But by doing this, within it's already only 1 month and a half, she lost 8 pounds already. And she says she has excess energy now, is willing to even walk outside of the house. She didn't even want to walk out of the house. So she can see herself is kind of changing, it's quite encouraging to her. And also interestingly, because she measures her sugar 4 times a day, because the doctor requires her to do that. So I'm seeing the figures of the sugars, again, within two weeks, this actually fluctuates. Sometimes even higher, sometimes lower, But after 2 weeks, you start to see some 5, 6, or 7 happens among this group of 10 or 11. You're seeing more and more of the normal, numbers, it's increasing. So now she's very, encouraged to do it. So, that's what I would like to share. And we'll get into Q&A if you have any questions. Hope not. Okay.
I have a quick question for you.
Yes.
You said with one of your patients you chose either swimming or walking in water. Is there a particular reason you chose that type of exercise?
Yes, I do. Especially for people who are having overweighted, it's so hard to ask them to exercise because it's a big burden for them. It's so hard for them to do it. Even exercise for 1 minute, they're dying. So when they're in water, the body weights were lifted by the water. So it's easier, comparatively easier for them to do it. Plus, by just walking, it's probably the most modest they can do and without hurting their joints. Okay, so that's why I encourage them to walk inside the water. Yeah, because their body weights will be lifted. Yeah. Okay.